Contact tracing, personalize, how affects me and you in the United States. Back when I was in Singapore last month and a month prior, I remember when the NRIC requirements started coming out. I read it about in the local newspaper, requiring something about this even digits on certain days, odd digits on others. But it is a wet market, so didn't seem like a big deal to me because I don't go to wet markets. I just go to grocery stores. I like to buy processed goods. But I wondered, will this spread? Is it like the mark of the beast? If you read Revelations in the Bible, or ever watched any movies or heard stories in church, at the end of the world, before Jesus is coming again, there will be the mark of the beast. And if you don't have the mark, you don't get anything. Some people had friends that would smuggle food to them. But is this it? Is it going to be bad? I do have a few friends in Singapore. Will they help me get food? Well, grocery stores were fine initially. This was just the wet market, right? And then going to the mall, supermarket, or wet market? I guess everywhere you need to have your ID. Okay. I first saw this app traced together when I tried to enter a mall, Orchard Central. They required the app to enter. I didn't have it, nor did I want to get it, so I tried to find another way in. Walking into Don Quixote, I found that they required me to scan it again, so I couldn't find my way in, so I just didn't go there. I could still go to grocery stores outside, right? That weren't in malls. Well, my Singaporean friend sent me an email saying, hey, by the way, you might want to bring your ID because NTUC Fair Price requires it. NTUC Fair Price is this big chain, probably the biggest grocery store chain in Singapore. And I said, huh? That's strange. I just went to one the other day and it didn't require it. But I read it online and it was there. So I was like, huh, what do I do? Maybe I'll try a different grocery store, a local one. Shenzhen, it's a small one. I went to one. They also required it. What then? Am I just out of luck? Do I just have to order delivery? Oh, but there's no slots for weeks. I guess I just have to go to restaurants? I had to differentiate between fear and reality. Would they accept my passport? Do they treat me differently because I'm a foreigner and not a Singaporean? Well, to the matter of passport, yes, sort of. Vivo City has a big fair price. I was going there one Saturday. At the mall entrance, they had a place to fill out the form. I filled it out, put in my passport information. But once I got downstairs to the actual entrance of the grocery store, because they closed the upstairs entrance, there was a long queue. And I didn't see any station where you could fill out the forms. Seemingly everybody just used the app. I didn't try to install the app. Can I even do it? Do I have the right information to install it with? Because again, I'm not local. And what about this information? Is it going to be in dangerous hands? Well, would you be relieved to know that Singapore has some guidelines on who could collect this information? They actually have a Personal Data Protection Commission. And here are their recent decisions. They seem to be pretty active, doing stuff. So does that make me feel better? Well, the US actually also has a privacy commission. Not that you would know it if you live in the US, because nobody seems to care. They have many cases as well. But we all know it's not very effective. Plus, a minor detail, the law about restricting NRIC doesn't apply to the government. And in the US, we already know that the laws don't apply to government. I don't know enough about Singapore to know how serious it is in terms of privacy concerns. But because I was listening to the news in Singapore, and I told you about how the news in Singapore is different than the news in the US in a prior talk, I was led to believe the government's fine. They'll take care of me. They do a lot of good stuff. But that's not the way I think of the government in the US. And that's not the way many people think of the government in the US. They lie to us all the time. And then they say, oh, sorry, I made a mistake. Really? And our companies here, Google, Facebook, well, Google tracks you even when you turn off your information on the phone. Even when you turn off your data or your Wi-Fi, they'll still track you. You can't really opt out of that. That's just required for basic functioning in Android, whatever that means. And we know Facebook obviously sells your information. They have to, that's how they make their money, right? In terms of Singapore, this Trace Together app that I never installed, the concept behind it is relatively simple. It's a Bluetooth-based system. The idea is that you keep track of who you come in contact with. If they have the app on their phone, you'll know. They'll know. There's a list of everybody you've been in contact with the past 2 weeks. Trace together, get it? And then I arrived back in the US, and I was in my friend's car. We were getting some food, and there had NPR on the radio, and I was listening to the governor of California, Governor Newsom, talking about how he was going to hire a team of contact tracers. And then I was listening to an ad, seeing if people wanted to join, sign up, call this number. The concept is somebody tests positive. They'll contact that person. They'll say, hey, where have you been these past few days? Let's review. They'll ask them if they have the contact information of the people they're in contact with, so they could contact them. But there's no app. There's no app in California. It's just this. Let's go back. Things required to make this effective, like the Korean system. Data. Not just a little bit, lots of data. Data that you could confirm with other data. So in Korea, after they determine your close contact versus a casual contact, you get movement restrictions. What does that mean? That person is then put under monitored self-isolation for 2 weeks using an app that tracks his phone to ensure he isn't breaking quarantine. Very interesting, right? But that's the Korean way, and it worked, as we know. So let's look at the things that are, quote, good and bad. This is an MIT technology review talking about different country systems, voluntary limited data destruction, sort of anonymization, minimize, transparent, the technology behind it, stars presumably being good. Well, let's look at this a little bit closer. Obviously, if you look at this, every country is radically different. Nobody's the same. So, centralization, opposite anonymization. Somebody's keeping track somewhere. In South Korea, that's what they did. They kept track. So they could have a command center. They could put out information. But if it's anonymized, it has to be like Bluetooth, so nobody knows, because you don't want government surveillance. But centralization is better for keeping this thing under control. Location. A lot of these places only do Bluetooth. They don't do location. Because you don't want people to know where you've been. In South Korea, you know exactly where they've been. They even know who's nearby. Because they know the location. And they give an example. If you're at a restaurant, the guy has it, there's somebody sitting nearby. They could recognize the face. They'll ask the person at the restaurant to run their credit card information. They'll go to the credit card company, get that information, and contact that person. Easy, right? For them. For ones that have Bluetooth, what if the person nearby didn't have Bluetooth? They didn't have the app. Well, it's pretty much useless now, right? Voluntary. Well, if it's opt-in, then not everybody uses it. Singapore, where people generally trust the government, 800,000 people had downloaded it by the end of last month. Considering the population is near 6 million, considering that it's an app that probably wouldn't work on a dumb flip phone, I don't think everybody can use it. It's the same concept like herd immunity. You need a certain amount of people to use it. When we just have a few people using it, it's just not that useful. In China, however, it's mandatory. And there's actually other countries where it's mandatory here in terms of voluntary. China, India. Accuracy. If we're relying on people just recalling information, like these contact tracers they're hiring, then it's not going to be very good because people are very forgetful. Sometimes you forget where you are, especially if you've been to so many places. Sometimes you forget, even if you haven't been to so many places. We just have bad memories. As a doctor, we know when you have the patient tell you the story, if you don't ask the proper questions, sometimes you don't get the proper answer. It's just because they forgot. But the phone knows where you were, even if you don't. Experience. This is an issue using humans. Contact tracers. California wants to hire a lot. 10, 20,000. Are there that many trained ones just doing other jobs right now? Obviously not. They'll have to train them to be, quote, disease detectives. But remember to talk about the nurses versus technologists and swabbing for strep throat? Skills and experience do matter. Follow through action. What do you do after you found out somebody had close contact? Is at high risk? Do you suggest they quarantine? What if they don't want to? You say, oh well, I tried. Well, South Korea actually quarantined them with a digital fence. In the US, we currently don't have many apps. It's going to be a patchwork probably when it comes out. There's one called Care19 in North and South Dakota. Uses a random ID so you're somewhat anonymous. Your location's kept only if you've been there 10 minutes longer. And I'm positive they'll ask you for information. So you could keep track. But it's positive. They have to ask you for your permission to access your information. It has location data, so that's good. But not many people use it. Now, where did they get the 10 minutes from? Utah. It's called Healthy Together. It's a voluntary app as well. The officials have a lot more access. Has a lot more ways identifying contacts with Bluetooth as well. Has access to your name, your contacts. It's centralized. Much less people had downloaded that. Google and Apple are coming together. Bluetooth only. No location tracking. No notifying authorities, just notifying the people who have the apps. Trying to build trust. To round it out, let's look at this blog by Jason Bay, lead for Trace Together the Singapore app. He mentioned some caveats. It's sort of like when we look at testing, sensitivity, specificity, how they're sort of adjustable. Where do you do the cutoff? He says, what do you define as a close contact versus not close contact? What about location? Because we don't collect that. Isn't outdoors different than indoors? It is. Is it truly 2 meters? 1.8, 2.1? What about new information? You get this one from Washington saying there's a super spreader event, 45 members diagnosed. Actually, the CDC report is a little bit different. But, a lot of people. There's a choir director, 61 people total, 60 members. One person was symptomatic, so they're probably the cause. 32 confirmed, 20 probable, 3 hospitalized, 2 dead. Aerosolized seems likely. Not everybody was within 6 feet of that one person. Close contact, how long do you have to be in contact? The whole thing was 2.5. But, they weren't sitting next to each other for 2.5 hours next to this one person. Was it just because it's aerosolized? Could you be farther but have a longer point of contact? How do you put all these things into an app? It doesn't have the intelligence to do that. Jason Bay was saying you need intelligent humans. Well, experience might help. You just have random people hired off the street. I don't know how useful that is. Anyways, this is some information to help you make a decision. Because an app may be coming near you soon, or you may get a phone call saying, hey, have a moment to chat. Could you tell me where you've been the past few days? It's coming soon. Prepare yourself. See what you want to do. Think it through, just like me. Idea of privacy. Helping others. How much of this is just about me? And how much is about helping other people as well? With contact tracing, apps, and disease detectives as well.